Good day, I'm Bibi, and now we're going to discuss the hypovolemic shock together with my partner, Miss Erica Joy Icaro. So first is, I'm going to discuss what is hypovolemic shock. So what is hypovolemic shock? So it refers to a medical or surgical condition in which rapid fluid loss results in multiple organ failure due to inadequate circulating volume and subsequent inadequate perfusion. So, hypovolemic shock is a life-threatening condition in which, if there is a severe blood loss or other fluid loss, our heart will unable to pump enough blood to our body. And if yung heart natin is hindi siya magpa-pump ng enough blood na magsi-circulate sa ating body, magko-cause yun ng malaking problema na cause ng hypovolemic shock. So, yun nga, most common cause ng hypovolemic shock is blood loss. So, when yung nangyayari yon if yung major blood vessel natin ay magbo-burst or merong serious injured. So, makukuha din natin yon yung sa heavy bleeding na magre-relate to pregnancy or from burns or even from severe vomiting and diarrhea. So, meron tayong tinatawag na two types of shock. So, yun ay yung hemorrhagic shock and non-hemorrhagic. So, the first one is the hemorrhagic shock. It can occur as a result of decreased intravascular volume caused by a blood loss. So, ito yung type ng hypovolemic shock wherein pag madaming nawala na blood sa katawan ng patient natin, yun yung doon na mag-occur yung hemorrhagic shock. So, yung next naman is non-hemorrhagic shock. Ito yung sinabi ko kanina na pwedeng ang hypovolemic shock is yung hemorrhagic shock ay mangyari if sa pregnancy, yung madaming nawalang dugo sa katawan, related sa pregnancy or burns. Then, ito namang non-hemorrhagic shock, pwede siyang i-relate pagka yung other fluid na yung maraming mawawalang fluid sa katawan like yung example is yung severe vomiting and diarrhea, 'di ba? Pagka nagka-severe vomiting or diarrhea, ang mangyayari sa katawan ng tao is magiging dehydrated. So, if ever malaking factor sa katawan ng tao if ever meron tayo ng severe blood loss or severe fluid loss like yung water or other fluids. Then, yung hemorrhagic shock, yun yung pag na-dehydrate yung patient or yung tinatawag nating sepsis, which is infection na pwedeng mag-cause ng organ damage or organ failure that can lead to septic shock. So, ang septic shock naman, ito yung malala na type ng sepsis na yung infection is magkakos ng biglaang pagbaba ng blood pressure ng ating patient. So, next is, what is the signs and symptoms of hypovolemic shock? So, how hypovolemic shock shows up can depend on a number of things, including the age of the patient, the past medical care and overall health, the cause of the shock or the source of the injury, kung ito ba is dahil sa blood loss or yun nga tinatawag na other fluid loss, or the cause of shock or the source, how quickly you lost the blood or the fluids, and how much your blood volume has dropped. So, next is yung causes, which is i-discuss po ni Miss Erica J. Icaro. Thank you.
Okay, for the causes of the hypovolemic shock. Next slide, please. So for the causes, first one is losing about 1/5 or more of the normal amount of blood in your body causes hypovolemic shock. Next is blood loss can be due to bleeding from cuts, bleeding from other injuries. For example of the bleeding from cuts is yung cesarean. And then next is bleeding from other injuries, internal bleeding such as the gastrointestinal tract. The next is the amount of circulating blood in your body also may drop when you lose too much body fluid from other causes. This can be due to burns, diarrhea, excessive preparations, and then vomiting. Next is the treatment of the hypovolemic shock. Next slide, please. So for the treatment principles of the hypovolemic shock, the first one is the initial treatment of shock states. Next is the so this one it has causative treatment also. The causative treatment also is the stop losses, or if it is essential role. Then next is for the surgical treatment when it is appropriate. Then next is the emergency surgery for ongoing hemorrhage. Then next is for the volume repletion or volume replacement. So it has the vascular access site. Next is the solution for volume replacement. And then last is the rhythm of administrations. And then for the volume replacement, so for the site of the vascular access, so for the first one is the peripheral vascular access. So it has a multiple access like for 2 to 4 veins. Then it has large peripheral catheters. Then it has also the external jugular vein. And for the advantages is it is a short time of installation, requires basic knowledge and simple materials, and it has a minor complications like hematomas, continuous seroma, and etc. So for the disadvantages of the volume replacement, so the diameter of peripheral catheter, it must be adapted for peripheral vein dimensions. And then for the vascular access can be lost. So it is a restless patient. So yon, restless patients during the transportations must be changed at 24 to 48 hours. And no catecholamines administration, so except in emergency for a short time period until central venous access is available. So for the central venous access, so after the peripheral vascular access is established and volume is replacement, it is initiated. So for the advantages of the central venous access, it is a reliable and long-lasting venous access like 7 to 10 days. And it allows CBV measuring and guiding of a treatment, and allows the administrations of catecholamines and hypertonic substances. And for the disadvantages of central venous access, so it has a risk of complications like for the installations, pneumothorax, cervical or mediastinal hematoma, and during for the utilizations and infections and gas embolism. And for the next is for the solution for volume of the volume repletions, it has the isotonic crystalloid solutions, hypertonic crystalloid solutions, and colloid solutions. So for the whole blood and the red blood cells, so it has a fresh frozen plasma, and for the platelets. So next one is For the rhythm of the administration, so rhythm of administrations depends on ongoing losses and stop losses. So rhythm of losses, it is kumbaga rapid po ito, rapid for minutes or hours, and slow for days installations. And for the patients with hypotensions, so the normal saline is 2,000 ml in the first 15 to 30 minutes. And after the 15 to 30 minutes, the volume replacement continues depending on the clinical and hemodynamic parameters like the BP, HR, like ito po yung mga vital signs. And then next is for the monitoring the treatment efficiency. So the clinical parameters, it has normalizations na po dapat ng mga vital signs natin like the BP, HR, pulse amplitude, skin color and temperature, mental status, and the urinary output. So for the hemodynamic parameters, dapat normal din ito like the CBP, PCPB, DC, RBS, and so on. So the laboratory parameters, dapat ito ay normal na din po like the acid-base balance, liver, renal test, like the HB, and so on po. Then next is the intratropic therapy. So this one has only after volume replacement and used to improve the cardiac output. And it has the butamine, so inotropic positive support. Ito yung nagsusupport sa ating inotropic. And it has peripheral arterial vasodilations. And for the vasomotor therapy or the vasopressor therapy, it is not recommended. Why? Because may aggravate the peripheral hypoperfusions and metabolic acidosis. So for the exceptions of this, it is only temporary. And in case of going hemorrhage, which outruns the possibilities of volume replacement, only until surgical procedures stops the hemorrhage or like the emergency surgical treatment, and noradrenaline, dopamine, and adrenaline. Those are the medications for the vasopressor therapy or the vasomotor therapy. And that's all for my part. And thank you. That's our report about hypovolemic shock.